Hello, this is Philip Ross. This is an AIDET presentation prepared mostly for physicians and hospital staff at NorthBay Healthcare in Fairfield, California. NorthBay Healthcare is a not-for-profit community health system committed to meeting the full spectrum of healthcare needs for the residents of Solano County from primary care through advanced life savings procedures. This presentation is called Journey to 2013 Communication. What has changed in the last 20 or 30 years? And I think everybody would agree with me that a lot has changed, from technology to the expectations of our patients to the norms and standards of our behavior. If you look at this Apple or Macintosh, 20 or 30 years old, it was tens of a thousand. It was, I think, $10,000 back then, and your today's iPhone is orders of magnitude more powerful than this computer with a fraction of the cost. A lot has changed, and the same thing applies to our expectations from patients as well as the way we communicate. And if you look at a fairly recent newspaper, that the article is called 10 Ways Patients Get Treated Better. And one of the 10 ways is that doctors are adopting a better bedside manners. So not only our patients are changing, our expectations of patients is changing, and we need to kind of go along with that. And that's what I mean by journey to the 2013 style of communication. Let's start with the simple questions. What do our patients expect? If somebody asks you that, what are you going to say? They want a nice bed, single rooms, good food, internet access? Yes, sure, you're right. But they really expect three basic things. Respect is the first one. Every patient desires to be treated with respect as a human being, as a person. They're in a strange environment, they don't feel good, they still do want to retain their personality, their stuff that is translated into respect. Confidence. What do I mean by confidence? I think every patient strongly desires to feel confident in the care team that will or does provide healthcare services for him or her. That means they need to feel confident that the physician, the nurses, or the other hospital staff is capable providing a high quality, reliable services. That's expected. And the last one is information, and everybody understands that. Patients need to know what's wrong with them, how long it's going to take for them to get better, how long they have to stay in the emergency room or in the hospital, what to expect. So, let's watch a movie. This is an excerpt of the 1991 The Doctor movie.
She's terrific.
This is a surgeon, cardiac surgeon in San Francisco.
You guys since your dad passed on.
And he's been having a sore throat. And he's about to witness on his own what is it to be a patient.
It was like this habit thing.
Hey, Jackie.
Let's watch him, how he interacts with his patients.
How's business in the big league?
We're killing him.
His patient.
Hi, how are we doing? I'm sorry I kept you waiting. Busy day. Are we looking after you?
Yes, thank you.
Okay. Have you been sore?
A little sore, yeah.
Okay. Oh, yeah, that's healed fine. Let's just get those staples out.
Doctor, my husband, he's a good man, and I think he's a little nervous. Will this scar always be so?
Tell your husband you look like a Playboy centerfold. You have the staple marks to prove it. No,
Is that the way to treat patients? You can be the greatest surgeon, but you're not the greatest doctor. And so we have a tool called AIDET. It's really a cane that should at the beginning help us to be consistently communicating with our patients their expectations, their desires. And what AIDET stands for is an abbreviation: A for acknowledgement, I for introduction, D for duration, E for explanation, and T is for thank you. And let's start with an A, the acknowledgement. Acknowledgement is the respect that patient desire. Acknowledge their presence. And you start with, before you even meet the patients, you knock on the door. You entering their room. I know it's your room, either it's an ICU or it's a hospital bed room or it's an office, but it's their environment. Knock on the door, give them a 2 seconds, and enter. The first thing is refer to them by their name. Hello, Mrs. Jones, not just hi. Extend your arm and shake their hands. It is the connection that matters. Look them in the eye. As you can see, it is the connection, it's the acknowledgement, it's the respect that you're transmitting to the patient through your body language. Very important. It is the connection that you make in the first few seconds of entering the room. And it's a connection that you cannot repair if you fail to do so. Sit down. It is now known that if you sit down in the patient's room, rather than hovering over them, the perception of time that you spend with the patient is translates into a much longer time. That means patients perceive the time that you spend with them much longer should you sit down over standing. I know it's not always possible, but try. It's much easier sometimes maybe to crunch down, get to their level, eye level, rather than sitting down if there is no space and for chairs. But keep that in mind. All right, the next is the introduction. Remember, the expectations of the patient is the respect. Number 2 is the confidence. An introduction is part of the confidence. So you meeting the patient for the first time, let's say. So this patient needs to know who you are. You're not doctors. You're not Jim. You're not Jim Smith. You're not really Dr. Smith. But if you say, I'm Dr. Jim Smith, it still clearly delineates that your role on the team. You're the physician. You're not the physical therapist. You're not the lift team. You're not the nurse. You're not the radiology tech. You're the physician. And by saying the full name, you give them a choice almost, so they can call you by their first name if that's what they desire. But also you soften it up rather than being just the Dr. Smith or just too familiar Jim Smith. You're Dr. Jim Smith. Now comes the hard part. You need to tell them why they should feel confident in you. That means, I know you're a specialist, let's say you're the gastroenterologist, but they need to hear that, what your specialty, what your role on the team is, but also what your training, maybe your credentials are. And that's difficult. It's been difficult for me to figure out how to kind of toot your own horn. So you can say, look, I'm board certified, I've been doing it for 20 years and I will take good care of you. Or you can say, I am board certified, I've been working with the same team for da-da-da amount of years, whatever. Something that you'll find that you feel comfortable telling the patients about yourself. But you do need to tell them something. And it's interesting, from my personal experience, when I meet patients for the first time about to do a procedure on them, only handful out of the thousands of patients would say, well, do you really, doc, know what you're doing? And it dawned on me that really everybody wondered the same thing, but only a handful of these patients had the guts to ask the right questions. And so since I learned about AIDET and since I start telling them why they should have a confidence in me, I noticed that significant percentage of people or patients would say, "Oh, I'm glad to hear that. Oh, thank you for telling me that." Clearly, they needed to hear that. So it's very, very important. Now, this is your option or your chance also to manage up the team that you're working with. This is the time when you can say, "Oh, Nurse Mary will be here shortly, and she is wonderful. She's been here for 5 years, 10 years, 2 years, but she's been incredible." When the nurse walks in the room, she can do no wrong. She's been introduced positively. The patient expects that she's great and she will do well. So this is the time to build the confidence in the care team. Let's go back to the original movie and
I'll
watch
write you a
how
note
our
with some
doctor did.
about it.
This time I entered some
Better I
text
should write to
to
Anne,
point out the
prescribe TLC.
crucial aspects
How is she?
that he failed to do. So let's
She's
watch.
terrific. I never see you guys since your dad passed on. No, I kept clearing my throat. It was like this habit thing. Here, Jackie. Thanks. How's business in the big league? We're killing them. Hi, how are we doing? I'm sorry I kept you waiting. Busy day. Are we looking after you?
Yes, thank you.
Have you been sore?
A little sore, yeah.
Okay. Oh, yeah, that's healed fine. Let's just get those staples out.
Doctor, my husband, he's a good man, and I think he's a little nervous. Will this scar always be so?
Tell your husband you look like a Playboy centerfold. You have the staple marks to prove it. No. Mr. Simoniu, I can smell.
He's right. No, no, no. He failed in every aspect. All right. So, what do you think about this slide? I'm trying to tell you. How is the shoe on the other foot? So now, this cardiac surgeon actually gets a diagnosis of presumably a throat cancer, and he goes to a specialty physicians. And now he's gonna try the shoe on the other foot.
See, Leslie, I'll check you out.
You're a gynecologist.
So,
Drop your pants.
Hello. Sorry to keep you waiting. Busy day.
Jack McKee.
Yes, I know. Have a seat.
Right. Murray Kaplan sends his best.
Oh, that's right. You're in practice together.
So we get it right.
So what seems to be the trouble?
What? Nothing. I have a tickle. I've been hoarse.
Take a look. Across your knees. Sit back in the chair. Get up. Hands on your knees. Chin forward. And
So now he got his taste of his own medicine. And you can tell, the desperation for the handshake. Lack of eye contact, no referral to his name, no explanation. Anyway, let's talk about the duration. AIDET, the duration. It's interesting is that I have changed my practice. When I talk to patients, I go specifically into this duration and explain them what to expect in terms of time. And it has clearly pleased the patients because I can tell that they are very much glued to the information about timing. They do want to know how long it's going to take the initial examination, how long they're going to spend in the operating room, how long they're going to spend in the recovery room, and things like that. And it's amazing. I didn't realize how important that information is to patients. And AIDET helped me to realize that importance. The next one is explanation. And I think that all physicians understand how important it is to explain patients what you're going to do, what are the risks and benefits. And I think that's we do most of the time pretty good job. Where we don't always do a good job is that we don't realize that certain abbreviations that are common to our practice are not clear to our patients. And so once I start paying attention to this physician communication aspect of patient satisfaction, I realized that quite often we use abbreviations that the patients don't understand, but don't say anything about it. Like, oh, you might have a C. diff infection. That's an example that happened truly in the emergency room where a couple came and patients was told you might have a C. diff. Well, the patient thought she's gonna have a cancer, and she had to look it up on her smartphone what C. diff is, and the next 15 minutes before the physician came back was terrifying for her. So things like that we take for granted, we need to be cautious about not using these abbreviations. Thank you. Now, this is not thank you for you listening to me, but this is a thank you to the patient. And I always say that practice of medicine is a privilege. It is not a right. And patients are giving you the privilege to take care of them or their loved ones. And they do deserve a thank you for that. And I think that since I start doing this AIDET, I go the extra mile. And when there are family members with the patients, I shake their hand as well, and I thank all of them for bringing their loved ones, for allowing us to take care of them, because I think they do deserve it. And quite often, as you can imagine, elderly patients, they're in the hospital, have their family members there, they're participating in their care, they're helping to watching over them, they're helping them to dress sometimes, and just general needs. They do deserve acknowledgement of that. And it goes a long ways to appreciate the help that you're getting. And last one is, I think that it's unreasonable to expect that you've been communicating with your patient a certain way for years or decades, and then tomorrow you're going to change your practice. No, it is a change that is a step at a time, and it's a step at a time improvement. And if you use the AIDET as a skeleton, and then you put your own stuff on the skeleton, eventually the skeleton becomes a second nature, and it will improve your not only communication but your relationship with your patients. And a better relationship with your patients does translate into being more efficient in terms of the time that you have to spend with the patient. It does translate into a better outcomes through more of a compliance. And I think, and I don't know if there are clear data to that, but I would expect that your chances of being sued are less if you have a good relationship with the patients. And I think lots of malpractice suits are originating in miscommunication and a poor relationship. Anyway, so this is my take on an AIDET. Again, if you think about it and you realize that there are very few things that you can change, and as I say, as what your mother taught you, it will go a long ways in improving your personal satisfaction with your practice as well as the patient satisfaction with the care that they received from you or your team.